Health experts in the U.S. are calling for China to comply with a full investigation into whether the coronavirus pandemic stemmed from a lab leak. Last week, President Biden ordered U.S. intelligence agencies to redouble efforts to look into this theory after a report suggested the virus may have escaped from China's Wuhan Institute of Virology. Leading scientists like Dr. Peter Hotez say the future of public health is at stake without a full understanding of the virus's origins, citing possibilities of a COVID-26 or COVID-32 in the future. For more on this now, let's bring in Dr. Peter Hotez. He's the co-director of the Center for Vaccine Development at the Texas Children's Hospital, and he's the dean of the National School of Tropical Medicine at Baylor College of Medicine. So listen, maybe like a year ago when this theory was floated that the virus could have leaked from a lab in Wuhan, and suddenly there were, to be frank, a lot of experts who said that's unlikely. They cited, that this is a lab that worked with, international researchers, and we would know if it was leaked. And now fast forward, and we're hearing something a little bit different. My question to you is, how common is it for viruses to inadvertently leak out of labs like this? That's what I want to know first off.
Well, it's actually quite uncommon, and that would be very unusual. When the original SARS hit China in 2002, 2003, there was at least one lab leak from the Chinese Centers for Disease Control in Beijing, and then one in Singapore, I believe, and one in Taiwan when they were learning how to work with the virus. And since then, biocontainment has really improved in quality, and that's why we allow biosafety level 4 facilities, for instance, in Boston or on Galveston Island here in the United States. So it's quite uncommon. I think I don't want to speak for the whole scientific community. I'll just speak for myself. I still believe, despite what that Washington Post title erroneously said, I think the lab leak hypothesis is relatively unlikely. I think it's, we don't really need to postulate it so far, given what we've known about coronaviruses. We've had SARS in 2002, 2003, Middle Eastern Respiratory Syndrome in 2012. That's why we began working on coronavirus vaccines, because we wrote to the NIH to say it's just a matter of time before we have a third major coronavirus epidemic or pandemic, and right on cue it happened. And that's why we were able to move so quickly to pivot when we had the COVID-19 sequence to turn our SARS and MERS vaccine program into a COVID-19 vaccine program. We knew this was coming, and we need to understand why. We need to understand why we've seen now a major coronavirus epidemic or pandemic every decade in this new century. Why is it humans are having greater contacts with bats through deforestation or expanding urban environments? Is it reflective of climate change? And there's so many things that we need to look at, and that's what we need to do. What we don't need is another intelligence investigation. We've had U.S. intelligence all over this for the last year and a half. What we now need is a thorough scientific investigation where a team of international scientists, possibly working with Chinese scientists, go into the field in Hubei province. There's some evidence that this pandemic may have even started late in the summer or early fall of 2019. Identify the possible origins, collect blood virus samples from wild animals, from domestic livestock, from laboratory animals, from people, identify index cases. There's a huge amount of work to do. It's not a quick thing. It'll take 6 months to a year. And we need to do this because what I have said is otherwise we will have COVID-26 or COVID-32. We have to understand why these are originating like they do.
So, Doctor, Anne-Marie asked how likely it was that this emerged from a lab leak and how common it was. Let's also talk about where things sort of got derailed, because like everything now these days in our society, things get political, even though they may have origins in science. This theory is a theory, and so it needs to be investigated, which is what President Biden is doing. The former president, President Donald Trump, had talked about this theory as well. At the time, there were public health officials and medical experts, including perhaps Dr. Anthony Fauci, who had dismissed it, that it was probably not possible. But the president and his followers, continued to talk about it. And one of the things that I think President Trump at one point said was that, he couldn't talk about it, that it was hush hush. And so, and now that this theory is being explored by President Biden, there seem to be some who suggest that perhaps the reason why the medical community was so quick to dismiss President Trump's support of that theory was because they were against President Trump. So just explain to our audience and explain to me, frankly, did this morph into what was actually a science-based investigation? Could this coronavirus have escaped or leaked from a lab, and now we're investigating whether or not it has? And was there perhaps a mistake made by members of the press to dismiss it out of hand once we heard other health officials say, yeah, it couldn't be possible?
Well, let's draw crisper lines, cleaner lines here to help people understand this. Most of the scientific community, and I'll put myself in that group, have said from the beginning we need to better understand the origins of COVID-19 for the reasons I just outlined, that otherwise we're doomed to have continued coronavirus pandemics. And we do need a thorough scientific investigation. As part of that, of course, you want to interview the scientists at the various institutes in Hubei province, as well as other Chinese virologists, to see if there is a possibility of a lab leak or a mistake. That was never discarded, but the point was it should be in the context of a wider investigation, not sort of a witch hunt against scientists, because that would simply be unproductive. Mm-hmm. The problem has been the way the Trump White House operated in the beginning. If you remember, you had I remember I was about to go on one of the cable news channels, and right before me, they were interviewing Peter Navarro, and he was making these outrageous claims that maybe the Chinese were deliberately sending infected individuals into the United States. And I just, how can you get anywhere if all we're hearing about are Chinese Communist Party conspiracy theories? This is unproductive and unhelpful. And of course, the Chinese are going to get their backup as well. Now, look, the Chinese have not been transparent. They've not allowed teams of investigators into the country. We have to find a way to make that work. And that's got to be a top priority for us right now.
Doctor, what's it been like in the past, when it comes to China and China cooperating? And I think you make a really good point that if the purpose of the investigation is to finger point and say, well, you're to blame, well, then, yeah, you're not going to get cooperation. If the purpose is to figure out how this started so it never happens again, that's entirely different. But it is going to be challenging to count on China to be transparent. Have there been previous investigations for sort of previous epidemics, like, say, SARS, or bird flu, or whatever? And how has China conducted itself during those investigations, if they have occurred?
Yeah, I mean, remember what you've got in China, especially in the middle of the country in Hubei province, which is right north of Dongting Lake, which is the big drainage basin of the Yangtze River. That's why it's called Hubei, means north of lake. It's very agriculturally rich. You've got this menagerie of ducks and chickens and livestock of all sorts, and water buffalo, and highly and a very dense population, and that creates lots of opportunities for zoonotic diseases, virus diseases jumping from animals to people. And that's why that's why we see a lot of the major influenza epidemics originate from China for that reason. And so a similar dynamic is in part in play for coronaviruses, although in this case bats have a seminal role. And yes, there are examples where we've investigated things like that. We've done this for Ebola, which also originates from bats. So there's lots of precedent, and there's a lot of knowledge base about how to do outbreak investigations. And that's what we have to convince the Chinese to do. It's in their own enlightened self-interest, because now we've had 2 of the 3 major coronavirus pandemics come out of China, and guess where? And it's likely the next one will come out of China as well. And so we need that international investigation. So there has to but the Chinese have to be approached in a way of a spirit of scientific cooperation, that we're going to bring in excellent epidemiologists and virologists and work hand in glove with Chinese epidemiologists and virologists. And there's a lot of good scientists in China that we've worked with over the years. And I think if, depending on how they're approached, I think they will relent and allow something along those lines, but not with the kind of rhetoric that's out there right now. That's a recipe for recalcitrance and refusal.
You know, and I've seen interviews that you've given, Dr. Hotez, and I recall that segment with Peter Navarro, and that seemed to be the jumping off point when members of the administration used it to fuel sort of anti-Asian sentiment in this country, and we saw it metastasize into where we are today. But you've argued that also that there is really no smoking gun here, right? Whether ultimately we discover that it came from a lab or that it came from an animal, the point is to try and prevent it from ever happening again. I mean, isn't that ultimately the goal here? It's not, as you were saying earlier, that some people have tried or have attempted to finger point or to blame a country for having nefarious purposes. That it's just to ensure that we don't face something like this again, even though all signs point to the fact that we most likely will.
That's right. I mean, we know COVID-26 is coming, COVID-32 is coming. I make up those numbers. I don't know the exact date that a coronavirus is going to arise, but that's why we're now actually not only working on a COVID-19 vaccine, but we're trying to pursue this possibility of creating a universal coronavirus vaccine that could cover the entire family of beta coronaviruses. It's a high bar, but we're worried enough about these other coronavirus epidemics happening that we're even working on that in the lab. So I think this needs to be the priority, and remember, China needs to allow this type of investigation to occur because the level of catastrophe from this pandemic is like nothing we've seen in modern times, not only from its impact on public health, but it's devastated the global economy. It's derailed national security for many countries. We haven't seen anything like this in a long time, and the only way we can prevent it from happening, other than building greater infrastructure for vaccines, which we're doing, but we need the bat ecologists and the virologists and the epidemiologists all working together to figure out what is the secret sauce that generates new coronavirus pandemics. It's the human race depends on it, and so there needs to be a fair bit of pressure put on China in the right way, though, not doing it in a threatening way, with a true spirit of international cooperation. And if they don't, then I think we also have to consider what other options we have, whether it's sanctions or other measures. But ultimately, we need that team in there to do the investigation.
Doctor, let me just ask you really quickly, just to follow up on that. So if we uncover that this coronavirus came from those bats, you mentioned earlier in our discussion SARS. Once it was uncovered that SARS came from these civet cats, that seems to have pretty much disappeared once we figured out how to handle those animals. How effective was China and other countries in helping to sort of, manage this cat population, which I've never seen one in real life, but I mean, so could we get the same kind of reciprocity if we uncover that it came from bats, that all countries, China and everybody else, will figure out a way to handle these bats so that we don't see a COVID-22?
That's right, and not only bats, but if it is jumping through an intermediate animal, as some say the civet cat in the case of the original SARS, some say the camel in the case of the Middle Eastern respiratory syndrome, some say the pangolin, which for this one, although it's not really clear if that's the case at all, then we have to look at what kind of human-animal handling is going on. There's this branch of medicine that we call One Health that looks at holistically the whole human virus animal interaction, and to see what kinds of things we can put in place to limit the potential for that kind of spread, and really get to an understanding of the forces behind it.
Really important. Dr. Peter Hotez, great to have you. Thank you very much for sharing this information. Really, really fascinating.
Thanks so much.